Lijo. 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 Person down. Someone please come. Initiate code blue. 1, 2, 3, 4, 5, 6, 7.
Code blue, Prudyala ground floor, reception. Code blue,
40,
Prudyala
50,
ground
60,
floor,
70,
reception.
80, 90,
Code blue,
20,
Prudyala
21,
ground
22,
floor,
23,
reception.
24, 25, 26, 27, 28, 29, 30.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
We watched in the video what needs to be done to save someone's life if we witness someone falling down unconscious or collapsing in front of us. Every 90 minutes, someone dies of a cardiac arrest. Heart attack and cardiac arrest are two terms that can be confusing. Heart attack is caused by blood clotting inside the blood vessel, supplying blood and oxygen to the heart. This leads to injury to the heart muscle. This is termed heart attack. Cardiac arrest is different. Here, there is complete stoppage of the heart, mostly because of abnormal heart rhythms. Cardiac arrest usually happens at home or in public places. Ignorance and fear are the reasons why we avoid helping these victims. If we provide basic life support in the first few minutes following a cardiac arrest, we can bring many of these victims back to life. Let's watch and learn the steps of BLS in the next video.
There are several steps in BLS that you need to perform when a person is unresponsive. First, scan the scene for safety, both for you and the victim.
For instance, asking the vehicle to stop if it happens in a public road. To disconnect the power supply before rescuing a person who fell down due to electric shock.
There are two types of system-specific chains of survival. One, out-of-hospital cardiac arrest, and the other is for in-hospital cardiac arrest.
If a person collapses, either at the home or in a public place, these are the steps to be followed. Activation of emergency response. High quality CPR. Defibrillation. Advanced resuscitation attempt. Post-cardiac arrest care. Recovery.
If a person collapses inside a hospital, the steps in the chain of survival are early recognition and prevention, activation of emergency response, high quality CPR, defibrillation, post cardiac arrest care, recovery.
A person collapses while he was waiting for the doctor's appointment.
It may be a cardiac arrest. The chain of survival begins when the rescuer recognizes it as a possible cardiac arrest. Effective, high-quality CPR provided immediately after cardiac arrest can double or even triple someone's chances of survival.
If CPR initiation is delayed, chance of survival is low due to brain damage.
So respond immediately if you see a person collapses.
Bystanders who are not trained in BLS are encouraged to provide hands-only CPR, also called as compression-only CPR, that is, push hard and fast in the center of the chest. Tap both shoulders firmly for response and call out loudly. If there is no response, you should check the breathing by scanning the chest for visible chest rise.
You may see gasping breaths in the first few minutes after sudden cardiac arrest, but these agonal gasps are not normal breathing. They are a sign of cardiac arrest. The mouth may be open and the jaw, head or neck may move with these gasps. Agonal gasp may sound like a snort snore, or groan.
If there is no breathing, only gasping, get help from others and initiate code blue. Initiate high quality CPR at the same time activate code blue.
If the rescuer is either a BLS provider or a healthcare worker,
Carotid pulse and chest rise must be observed within 5 to 10 seconds to confirm cardiac arrest. Use 2 to 3 fingers to locate the trachea and then slide your fingers into the groove to identify the carotid pulse. Simultaneously, scan the chest for visible chest rise. It should not exceed more than 10 seconds.
place the patient face up on a firm, flat surface to maximize the effectiveness of chest compressions. Remove the clothes to expose the chest. Place the heel of one hand in the center of the chest on the lower half of the breastbone. Place the heel of the other hand directly on the top of the first hand and interlace your fingers. Center the shoulders directly over the hands. Use both hands to give chest compressions and keep your elbows straight and push straight down. Allow the chest to completely recoil after each compression. Aim for a compression depth of at least 2 inches. Compress the chest hard and fast at a rate of 100 to 120 per minute and count out loud. Switch compressors about every 2 minutes or earlier if fatigued. The switch should take only around 5 seconds.
When you stop chest compressions, blood flow to the heart and the brain stops. So you must minimize the number of interruptions. 2 breaths after 30 compressions will increase the oxygen supply to the vital organs. Seal the pocket mask firmly against the face after using head tilt, chin lift to open the patient's airway. The tip of the mask should be at the bridge of the nose and the mask should cover the face till the chin. Make a good seal between the mask and the face with both hands and deliver each breath over 1 second. 2 breaths should be provided after each sets of 30 compression. Automated external defibrillator is a portable, lightweight device that can identify abnormal rhythm.
Place one AED pad just below the clavicle on the right side and the other pad 6 to 8 cm below the left armpit.
AED can deliver a shock and convert abnormal rhythms back to normal. AED uses voice prompts, lights, and on-screen messages to guide the rescuer.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light.
Continue high-quality CPR until the code blue team arrives or person regains consciousness. Heart disease is the #1 cause of death both men and women globally and claim more lives than all forms of cancer combined.
Cardiac arrest may be caused by almost any known heart condition and is often fatal if appropriate steps aren't taken immediately.
Cardiac arrest does not discriminate. It can affect all ages and genders.
This is why early recognition and immediate cardiopulmonary resuscitation or CPR are crucial for survival from cardiac arrest.
Healthcare providers are the backbone of system of care in both community and medical facilities.